Hi there, everybody. So this is another update on my sesamoid journey. The last video that I posted was kind of in a bad place physically and emotionally. A little better emotionally, so thought I would get back on here and kind of give another update and let everybody know where things stand. Again, these videos are really intended to be informational for anybody that is thinking about a sesamoid operation. So here's what's happened. So in the last video, I explained that my remaining sesamoid, which was the inner sesamoid, the one closer to your arch, had fractured, and that was after having the outer fibular sesamoid removed. So that sesamoid, the fibular one, had been shattered or fractured for a while. Had arthritis going on, and it was causing problems. And so anyway, I had it removed. 3-4 months after the surgery, I had some pain on the arch side. Went in and turned out my other one was fractured too. So in terms of sesamoid issues, it's about as bad as it gets. The main reason, again, that I'm doing this video is just to let folks know something I've learned, and I really want to encourage everybody to consider asking your podiatrist or your orthopedic surgeon about it. You should ask for a bone density test. Even if you don't get one, you should have the discussion first before you even consider the surgery. So I saw Dr. Michael Perez, who is a podiatrist at Dublin Foot and Ankle in Columbus, Ohio, or Dublin, Ohio. And so throughout the times, all the discussions prior to the surgery, not once was it ever discussed that I should have my bone density checked. So there was really no reason to apparently believe that the other one was injured. Although when you look at my MRI, I had marrow edema in both, which I had mentioned before in an earlier video. I find that a little interesting. But anyway, it is what it is, and here we are. So I had the bone density screening done, and basically what I found out is that I'm 2.5 deviations below the average. It's a real vague number, what the average, what's 2.5. I didn't know, but I've been Googling it because right now I'm in between that bone scan and what's next. And basically the gist of it is that 2.5 is right where osteoporosis begins. So I'm 33, obviously male. When you look at the risk factors, I really didn't have any of them. Except for multiple fractures, which there's just no way you could really know that unless you did the bone density screening before the surgery. So I really want to emphasize, get it checked, because I truly believe that if I had found out that I had, borderline osteoporosis, I wouldn't have had the surgery. And that's a big deal. So for all the podiatrists and orthopedic surgeons that might be watching, maybe consider offering that as a suggestion to your patients, because frankly I'm not too thrilled that it wasn't suggested in my case. I also get that, again, I don't meet the normal criteria or appearance, but we're talking life-altering decisions here. So, I've been now to a few other doctors. Nobody really wants to take sides. I know that that scan should have been done. So, do not have a sesamoidectomy without getting that done first. Because the extra weight on your other sesamoid, this is something you don't see much on the internet that talks about this. You have this out, and a lot of these articles will kind of say, well, that's the, you go through the orthotics and then this and then that, and then you have the sesamoidectomy, and they kind of stop there. Nothing goes into long-term studies. You'll see some percentages in these obscure medical articles, some from the early 1900s, that give good statistics, pain-free, blah, 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 these percentages. Basically the picture is painted as if that's how you deal with it. That's the logical next step. And I was truly believing that. So, maybe that's the case with most folks. I don't know. But get the bone scan done. Because I would have never in a million years guessed that I had any kind of bone condition. My family has strong bones. Osteoporosis does not run in the family. Aside from these 2 fractures, really haven't had any broken bones throughout my life. I've had good teeth, barely any cavities. It just doesn't really add up, and I drank a lot of milk as a kid. So it just goes to show, I'm sure most people don't have bone density problems, but I did. I didn't see it coming, and I'm pretty sure it's going to affect me for the rest of my life. So, my life right now is the boot. Sorry for the mess, but the boot there. So I'm in a full-on boot. It comes up, I don't know, a little bit past my calf. This is an immobilization boot. Basically, I can't move that big toe joint at all because they're trying to get that fracture to heal. Which is probably not going to happen because, if you already don't have good bone density, and if there's any hint of a vascular necrosis, which is a low blood supply basically, which I'm told there might be in my case, it's an uphill battle. So I'm icing every night. There is a wonderful website. I believe it's called Dr. Blake's Healing Soul. He's a podiatrist out of California. I really, really strongly advise that you Google that site. Take a look at his basically message board, and he still replies to things on there. Even though a lot of the posts are really old, he even replied to me. He has the most comprehensive sesamoid information that you're going to find online. One of the things he suggested to me, at least in this case, is doing contrast baths. Nobody around here has suggested that to me. I went to 2 orthopedic surgeons after I found out I had this other broken bone. And, they're smart people, but all they really are saying is, wear this boot 6 weeks, come back and see us. They didn't give me anything else to try, nothing about contrast baths, nothing about icing, and didn't even really mention NSAIDs or anything. So, and according to this Dr. Blake, there is also some sort of, I don't know if it's an ultrasound, but some sort of bone stimulating device that could be used. Well, of course, I'm assuming you need a prescription, referral or something for that. So I don't have that. But I'm in a really bad place physically. I get along with this boot, but it's a burning, tearing type of pain. It's the fracture. If I could compare them, the fibular fracture. I mean, I'm one of the few people that can compare them. The fibular sesamoid fracture, much less painful than the tibial. The tibial, it hurts, and it's big time hurt. It's a bigger bone, more weight on it. You don't want to break that one. Or if you do, you want it out of there, I guess, if you got the fibular, but I'm just SOL. So, anyway, I got 20 seconds left on this video. Get a bone scan done, and I guess beyond that, good luck to you, and maybe someday they'll get us implants for these sesamoids. Take care.